Good afternoon, everyone. Today, I will be presenting on a very important topic in clinical practice the assessment and management of community acquired pneumonia. I will start by discussing the CURB-65 scoring system, which helps us to assess severity and guide treatment decisions. Then, I will move on to the management strategies, including when to treat in the community and when to consider hospital admission. By the end of this session, you would have a clear idea of how to apply the CURB-65 score in daily practice and how it influences the overall management of community acquired pneumonia. So let's get started. In CURB-65 scoring, at first we have like C. So with C, this means confusion. So how will we score the confusion? So in mini mental state score or MTS score, the mental test score will be less than or equal to 8 on 10. Then comes U. So U means urea, which means like when the urea is more than 7 millimole per liter. Then comes to R. R means respiratory rate when the respiratory rate is more than or equal to 30 per minute. Then B. B for blood pressure when the systolic BP is less than 90 millimeter mercury or diastolic BP is less than or equal to 60 millimeter mercury. And 65 means the age. When the age is more than or equal to 65, then it is one of the severity criteria that we use to scoring the pneumonia. So now come to the scoring system. So when CURB score 65 is 0 to 1, 0 or 1 means you have only urea more than 7. No other points are present or no points are present regarding pneumonia. At that time, the score is 0 or 1. So in 0 or 1, the mortality rate is low, only 1.5%. So you can treat this patient at home. Now come to the scoring system when it's come to 2. Means when you have confusion or urea or respiratory rate more than 30, like in 5 of these, you have 2 positive findings. At that time, the score is 2. So in scoring 2, the mortality rate is intermediate, means 9.2%. So at that time, you consider hospital supervised treatment, either short stay in hospital or hospital supervised but outpatient treatment. Now come to the scoring system 3, which means the mortality rate is high, 22%. So in this case, you need to manage the patient in the hospital as severe community acquired pneumonia. After that, if the score is 4 or 5, you need to admit the patient to the ICU. Okay, so up to this, it's now fine, like where we treat the patient at home or hospital or whether in the ICU. Now come, how will we manage the patient or what antibiotic should we use? So for home treatment, we can use oral amoxicillin. If someone is penicillin allergic, at that time you can use oral erythromycin or oral clarithromycin. So now we can treat the patient with oral treatment. After that, if the patient is need hospital treatment but not severe, you can give oral amoxicillin plus oral erythromycin or oral clarithromycin. So what is the alternative if the patient is allergic to amoxicillin? At that time, you can give oral levofloxacin or oral moxifloxacin. Now comes to the most important part. If you are treating the patient in the hospital as well as the patient is suffering from severe community acquired pneumonia, at that time you need to give the patient IV, means intravenous line, and you need to give the antibiotic through the IV line. What antibiotic is the best at that time? You can use IV coamoxiclav or IV cefuroxime or IV cefotaxime. With that, you need to include oral erythromycin or oral clarithromycin. If you cannot give oral IV coamoxi or cefuroxime, at that time, what is the alternative? The alternative is you can give oral levofloxacin plus IV benzyl penicillin. I hope you enjoyed this session. Thank you.